earlier videos, we have discussed about the limiting, supporting and relief areas of maxilla and the limiting and supporting structures of mandible. In these videos, we will cover about the relief areas in mandibular arch and its importance. Relief areas are the areas which either resorb under constant load or have fragile structures within or are covered by thin mucosa which can be easily traumatized. Hence, these areas should be relieved. Genial tubercles or mental spines. They are situated on the lingual aspect of the mandibular body in midline, slightly above the border. Its clinical significance is that if the loss of residual alveolar ridge is extensive, these spines are more superior in position than the crest of the ridge. Dentures overlying this area without relief may traumatize the soft tissue covering the genial tubercles. So the denture base should be relieved over this area. Next is the mental foramen. Mental foramen is located on the lateral surface of the mandible between the first and second bicuspid, halfway between the lower border and alveolar crest. As the resorption takes place, mental foramina will come and lie closer to the crest of the ridge. In these circumstances, the mental nerves and the blood vessels may be compressed by the denture base. So the denture base must be relieved over the foramina. Mylohyoid ridge. Mylohyoid ridge is an oblique ridge on the lingual side of the mandible extending from the third molar region to the lower border of the mandible in the region of chin. It is most prominent in the third molar region to the area of the second bicuspid. This area should be palpated with index finger and its prominence should be noted. The mucosa in this region is thin and poorly keratinized and is very prone to trauma. So the mylohyoid ridge should be relieved. The lingual flange of the mandibular denture should extend inferior but not below the mylohyoid line. Thin and sharp mylohyoid ridge can cause ulcers. Mylohyoid ridge with undercut creates problems with construction of a denture. And here the surgical correction would be necessary. When it is very prominent, it can compress the tissues over there and it can cause numbness or other discomforts to the patient. And these relief areas has to be very carefully examined in the patient mouth as it is very important to relieve these structures to get a comfortable denture. A thorough knowledge of oral anatomy helps the clinician in identifying enough landmarks that in turn acts as a positive guide in treatment planning. In my videos, a review of all the intraoral anatomical landmarks is being presented and analyzed in various parts. Kindly watch those videos and it would be helpful for your studies.